Well, hi everybody. I know most of y'all, not all of y'all. I'm Amy. I'm the nurse over at the school. So today we get to do the super fun annual training about non-exciting topics, but my whole goal is to make it relevant, rememberable, and pertinent to where you are and why we kind of have to do this every day. One of the things I'll talk about a couple times is the reason we do this every year is something so basic as hand washing. Why do we talk about it all the time? Is because most people don't do it right. Like, I think it's 87% of adults who know they are being monitored for hand washing don't wash their hands correctly. Like, it's profound. It's obscene. So those of us, when we know we're not being watched, you know, the chances of us washing our hands correctly goes even lower than that. So, and hand washing, I would argue, is one of the most important things we can do to keep ourselves, our families, and our kiddos healthy. In my opinion, even more important than any of the other, just about any of the other protective things we do. And the reason is this, is we touch a lot of things. A lot of people, you know, we shake hands, we touch tables, we touch cups, all the things, and then we go to eat or drink something and we put it in our mouth, you know, germs. And hand washing can help prevent that. The other thing is a lot of germs that make us sick, especially the GI bugs that make us sick, are very resilient and they're very hardy. Some of them are enveloped in like a layer of fat, so they're protected. So like a quick wash doesn't do, because that fat needs to be broken down by like soap or like the friction of rubbing it off. And some of them are even like dual coated. So getting rid of them is even harder. An example I like to use is, I don't know if any of you have ever heard of Cryptosporidium. It's a GI bug that when I was in nursing school in Milwaukee got in our water supply. And water supply, city water supply is cleaned. It's filtered. They even use like a little bit of bleach in there to kind of clean, to kill the pathogens. Well, bleach doesn't kill crypto. Hand sanitizer doesn't kill things like crypto. You can have crypto on your hands and put your hand in hand sanitizer for an hour or bleach, and it would still be there. It would still be alive. It would still be there and still able to make you sick, which is why hand washing is always the gold standard as far as cleaning your hands. Hand sanitizer is nice when you don't have soap and water available. You know, that's nice, and it's certainly a useful tool, but that's why hand washing is always better. And not only that, hand washing for the full 20 seconds. So, because if you just, 1, 2, but that's why the full 20 seconds, because some of those who have like that big, thick casing, that coating on them, it takes a while to break that down, so the soap can actually get in and destroy, you know, the virus inside, or just, you know, the friction of rubbing it off, because just like a quick like this, it can still be on your hands and make you sick. So with that being said, the right way to wash our hands is a lot of times, even I don't do it right. We're supposed to get our hands wet first and then put soap on our hands. And I wasn't going to call her out, but since y'all are looking.
I did not.
What's the reasoning behind that?
Okay, so the reasoning behind that
Maybe I need to do it again.
is because if your hands are wet and then you put soap on, it's easier to kind of get the soap in all the little nooks and crannies and move it around. Versus how I usually do it, honestly, if I'm not being mindful of how I'm doing it, is I'm all about efficiency because I'm running around. I have one hand to turn on the water and the other hand is getting the soap. Typically is how I do it if I'm not thinking about it, right? Just out of habit. And then I might add a little water and kind of scooch it around a little bit. But officially, we're supposed to get our hands wet first, and then soap, and then scrub for 20 seconds. Tops and bottoms, and in between our fingers, underneath our nails, and then our wrists. Now, we go through life, most of the things we do is out of habit. So if we're not mindful of it, it's super easy to skip a step, like getting your hands wet first, or making sure you're scrubbing for 20 seconds. The other thing is when you're scrubbing, if I'm not mindful, I've shared with you guys before, I forget when I'm doing tops and bottoms and in between my fingers, I forget my left thumbkin. For whatever reason, I'm really good about the right one, and if like I'm just kind of rubbing, and I notice I even do it with lotion, like if and I'll even get my wrists right and around, and I'll do under my nails, but if I don't think about it, I forget my left thumbkin. So pay attention, like the next day or two when you wash your hands. Just kind of do it like you normally do, but just kind of observe yourself. Is there a spot that you normally forget? There might be. And when we're in a rush, our brain reverts back to habit because I'm thinking of the next 5 things I have to do in my day and not necessarily paying attention to what I'm doing here. It's really easy to either not do it right, not do it long enough, or miss a spot. Does that make sense?
Yes.
Okay. So, hand washing, as boring as it is, as much of a habit as it is, as much as, I talk about it, as much as I need to think about it, again, because it's so routine, it's a habit, our brain doesn't pay attention to the details. We just kind of do it, and then we don't do it right, and then we don't get the full benefit of it. I would guess, and I haven't read a study on this, but I would guess that we could minimize illness in ourselves, our kids, our families, by at least, I would guess, 75 to 80%, honestly, if everybody washed their hands correctly. That would just be a guess. I would be shocked if it was much less than that. Really shocked. Just because it's so easy to, touch. I'm touching this table. How many people have eaten here today, right? And then I rub my face, and I'm doing this, and I do. Well, right. And then I go put a piece of gum in my mouth, or I go, eat a cracker or whatever. And I've introduced that into my bodies. Now, the beauty of working in a place like this is we're around germs all the time. So typically our immune systems are pretty hardy. And we don't necessarily get sick like other people do, or for as long as, just because we're around it all the time. Our immune systems have kind of bolstered themselves up and are stronger than most. But it's still easy for us to, if we're exposed to it, to pass it on to other people, where our body won't get sick from it because our immune system will fight it off. It's still there and present, so it's easy to pass on to someone else. Does that make sense? Okay. So hand washing, as boring of a topic as it is, it's super important. And the other thing is when you, when like licensing comes to observe, or like by us, we call it accreditation. We have an accreditation team come to look at how we're doing things. They're not going to ask you. They might, when you wash your hands, how long do you wash your hands for? But they're going to watch you. Even if they're across the room, they're going to see how long do you do it. And when we're nervous, the first thing our brains kind of forget is detail, right? Because when we're nervous, like the accreditation team is here, I need to be on my A game, or whatever, or we're stressed out, the first thing to go is detail. Because when the way God made our brains is when we're stressed out, detail has to go, because I have to focus on survival, right? I have to focus on the negative. I have to focus on where's the threat. And the threat right now is over there, that lady with her little clipboard and her little pencil. So I'm focused on her, and I'm not paying attention to what I'm doing. So if this is a habit, though, because I do it every day the same way, like I don't have to think about this, the chances of me doing it right, not that we do it right just so we don't get in trouble, but we do it right so we stay healthy and everybody else stays healthy. But does that make sense? Like why we talk about it all the time, so that we can just continue to kind of assess, what are my habits? How do I do this? And even now, to this day, if I'm not paying attention, I'm like, oh, left thumbkin, there you are. I got to wash you too. And I still have to be mindful of that, because for whatever reason, I leave him out. I don't know. Questions about washing your hands. I'll get to like when and like the how. Okay, so just make sure, like those little cracks and crevices. And the other thing too is if it's cold outside or anything, every couple times you wash your hands, maybe put lotion on so you don't get like those little cracks and stuff in your skin, because the soap can be hard on our skin. So hand washing versus hand sanitizer. Now, if you don't have soap and water available, hand sanitizer is okay. And for our kids, as long as they're 2 or older. But it doesn't kill everything. So soap and water is always the better answer. Hand sanitizer is good in a pinch, and it's okay sometimes. But if there's ever anything where like you clean a dirty diaper, like you help someone in the bathroom or change their diaper, anything GI, I would wash your hands, just because, like I said, those GI bugs are the ones that are the hardiest, because they have to survive that stomach acid, right? So they're kind of built for that. So wash your hands. Now, there's a whole litany of times of when we need to wash our hands according to the state, and they have 13 listed. But I'm not here to help you memorize 13 times that you need to wash your hands if you just think of it like the transitions. You have to wash your hands during transitions. When you first get to work, that's a transition, right? You're coming into work. Wash your hands before you go into your classroom so you don't bring whatever's at home into here. If you're helping someone, use the restroom, or you use the restroom, that's a transition. If you're helping with lunch or you're going to eat lunch, that's a transition. If you're coming in from outside, that's a transition. Does that make sense?
Yes.
So my brain can't remember all 13 times, right, off the top of my head. But if I just think about the transitions, if I'm, helping someone, anytime I take gloves off, that's a transition. I have to wash my hands. Okay, so if you think of it like that, then that'll kind of help remember all 13 times that we have to wash our hands. Now, our kids have to wash their hands too, like even when their diapers changed or when they use the bathroom. I know we use wipes for like the little ones, the infants, or the kiddos wash their hands at the sink, because there's a risk that, they might not be like running their hand up their backside, but they're not still on that table. They're always kind of moving and shaking, and then they kind of move and things shift around, and then they touch the table or whatever, and the chance is there. So that's why we help them wash their hands too. Hand sanitizer, like I said, is for 2 and older, specifically for you guys. It always has to be out of the reach of children, and if you have hand sanitizer in your room, make sure it's out of their reach. It's supervised if they're 2 and older and you use it. And check the expiration date on the bottle. Some will have it, some will not. If there's an expiration date on it, you have to throw it away if it's past the expiration date, okay? Anything with an expiration date on it in my office, I have a red Sharpie date on it, and that's the expiration date. Just because my brain doesn't think about that every time I use hand sanitizer or every time I grab Tylenol. It just, right, that's an easy detail to forget because my brain is 5 steps ahead of where I am right now. So it just helps my brain, oh yeah, it's not expired yet, right? It's in red. It's the only time I use red Sharpie is an allergy or an expiration date on my stuff. So it's just like a quick reminder to my brain to check the expiration date. So if parents bring you meds, the Boudreaux's butt paste typically has an expiration date on it, just right on the bottom, an expiration date or whatever, just so that, because that's important. Hand sanitizer, washing your hands when. Any questions about washing your hands? Mm-hmm.
So whenever we're doing changing diapers on the changing table, okay, so we wash our hands and then we change the child with the gloves, and then we wash their hands, and then we wash our hands, and then we clean, and then we wash our hands again, and then change another child. That's how we do it, okay? Because sometimes I don't know to clean and then wash my hands or wash, but
well, so if you think about, because we can't see germs, they're not visible. So I think of germs like anything I touch that could be contaminated is like paint. So if I touched, my cup, I now have red paint on my hands. So if I change a child, or purple or pink or whatever, like I have, purple paint on my hands, so my hands are dirty. So if I now grab the bottle of cleaner, and it sounds kind of counterintuitive, but yeah, I mean, I would, and that's a lot of hand washing for y'all with the littles, like I get it. The other, officially, I don't see it in here, but the other thing I might do is I might take off one glove, grab the bottle. Officially, it's not clean because I have to wash my hands after gloves, and I might spray it down, and then with the gloved hand wipe it down and then clean both hands. And then honestly, for my cleaners, my cleaners, my hand sanitizer bottles and all the things, every now and then I'll grab a wipe and wipe those down too.
Yeah.
Just, it's like in your kitchen, right? What's the dirtiest thing? Your sink and your sponge. Yeah, so I wipe them down too. It's just but yes, officially, yes. Does that make sense?
yes.
Good question.
Just wanna make
No,
clear
absolutely. Yeah,
steps.
yeah. That's a good question. Any other questions on hand washing? Okay. And hand sanitizer, gloves. Obviously gloves when you're touching any body fluids. Wash your hands when you're done. Okay. Next topic is when should kiddos stay home and not come to the center? What's your temperature threshold? Do you know? Like when they have to go home or can't come?
100?
100. It used to be 100.4. Then COVID happened. Everything lowered to 100. And then some went back up to 100.4, and then some stayed at 100. We just kind of kept 100 across the board. It's just easier. There's not a whole lot of difference between 100 and 100.4, so we just kept everything 100. Any kind of rash that's not, like heat rash or something that, like diaper rash or something. Diarrhea, vomiting for 24 hours, if they're not up to date on their immunizations. Okay. Questions on that? No? Okay. Meds. These are your med forms that you guys use here. What's this one for?
Sunscreen.
Anything else?
Any other ointments?
Like bug spray too? Does bug spray go on this one?
Yes.
Diaper cream?
And diaper cream? Okay. And then everything else goes here. How often do these need to be renewed or re-signed by the parent?
Weekly?
This one too?
No.
How long is it?
Expiration date? Expiration.
Of the med? Or room change?
And the
And room change? Like when they move up? Okay. Sorry.
Right?
Mhm.
Yes, we have new ones.
So this one, if Timmy has an ear infection and Timmy needs Tylenol every now and then for his ears, mom can bring Tylenol and it's only good for a week, right? And then maybe next week that his ears are still bothering him because the antibiotic isn't working right, she just re-signs the form, okay? When you give a medicine here, you have to write your own name down that you gave it. Like you can't tell me, hey Amy, I gave Tylenol at 3:45, can you go sign it off for me? Officially, that's a no-go, okay? We have to sign our own meds, that we gave it, when we gave it, the time, the dose, all the things. Now, when giving medications, this is another time where our brain likes to get into a habit because it's something we do frequently in the big scheme of life. We take Tylenol for a headache. If we have kids, we give them Tylenol for a headache, right? We don't think about it. We might take a vitamin every day. We don't necessarily think about all the checks and balances that are in place. So this is another thing to be mindful of that we do every day. I've been a nurse for over 25 years. I've been giving Tylenol for a very long time, and I still, every single time, will check the bottle. I will check the dose, just because it's so easy to get it wrong. I've had med errors. They're horrible. I feel horrible. Thankfully, I haven't had any bad outcomes. But it's not a good feeling. It's not a good feeling. It's a risk for the kiddo. You feel horrible. You have to call poison control. You have to call licensing. You have to call the parents, like all the things. It's just so easy to avoid if we don't let our brain just take off and go do something else while we're doing something like this. So check all the things. You have the right medication. It's Tylenol, not ibuprofen. They look similar. They can both be white. They can both be in a white bottle with a white cap, right? They can both have a white bottle with a red label depending on the brand. They can both be grape flavored. They can both be berry flavored. Like, there's so many similarities between the two. And a lot of times when we talk, we use them interchangeably, like Tylenol, ibuprofen, like they're kind of the same thing in our brain. So, the right med, the right dose, the right person. So how I check to make sure I have the right person. Over there, my kiddos are a little bit bigger, but even my 4s. Hey, Timmy, how you doing today? Here's your Tylenol, right? Because my brain knows I'm giving medication to Timmy, but if I'm thinking about Sam, I might be thinking about Sam because I have to go see him next, so then I might accidentally look for Sam and give it because my brain's trying to keep me efficient, right, and keep me kind of ahead of where I'm at. So I will always validate their name with them, and if they're too little for that, I'll validate it with another teacher. Hey, this is Timmy, right? This is Timmy, right? Like the first month of school, I tell all my teachers, especially with my new pre-Kers, this is Timmy, right? Because I just don't want to get it wrong. Because sometimes you ask them, what's your name? I don't know. Right? That's reality. Or are you Timmy? Yeah, I'm Timmy. And they're really not. So just validate it somehow. And even my middle schooler kids. Hey, Susie, how you doing today? Great. And I tell my kids all the time, if what I'm giving you doesn't look right, question me. Just because I'm an adult and you're not, question me. If I'm giving you something that's purple and it's usually white, ask me. It's okay to ask me. And when they do, I like celebrate the heck out of that. I'm like, yes, thank you for doing that, because this is super important. You don't ever want to take anything that you don't think it's right. Sometimes the manufacturer changes, so the color of your pill or your liquid or whatever can change. And so then I can explain to you, but you know what you're taking. So I try to empower them too, which again is hard for your littles, maybe when they're a little bit bigger. But I always tell them, if what I'm doing doesn't make sense, ask me about it before we do it, because I don't ever want to get it wrong. Or I might have like 3 meds that I'm giving and I grab the wrong one to give it to you. Oh, mine's not orange. Oh, wait, yeah, right? Like that's a good check for me too, to make sure that my brain's not racing ahead of where I'm at. The expiration date, the medication, the person, the time, and the dose. Probably more of an issue for me over here, but things like ibuprofen, Advil, they're the same thing. You can take 1 to 2 every 4 to 6 hours. Well, sometimes people take 3 or 4, and that's because prescription strength is 3 or 4. You can take 600 to 800 milligrams of ibuprofen, and people know that. So then they assume that I can give their kiddo that. I can give them 3 or 4 ibuprofen, and I can't. If the bottle says 1 to 2, unless I have a doctor's order, and I've gotten doctor's orders for more, but unless I have a doctor's orders that says I can give 3 Advil, I can't give 3. I can only give 2 because the bottle says so, and I'll tell them that. Hey, just call your doctor. They can fax it to me. You can pick it up or whatever, but until then, I can only give them 2 because that's what the bottle says. And sometimes you'll have a big old chonky, 4-year-old, and most kids' meds are based on weight and not age, so sometimes they're out of the age bracket and in the weight bracket. And then how do you know what's the right dose, right? So just verify that. I think you're still okay as long as you're giving it within the weight range and not the age range, because it is within label directions, but typically kids' meds are by weight. And then always do a gut check. And this is a safety thing that I learned a long time ago. Like if something doesn't make sense, I have people tell me, here, give him Tylenol, he's got allergies. So then I try to educate them. Okay, so Tylenol might help with like a headache with the allergies, but it's not gonna help with like the stuffy nose and stuff. And not everybody kind of understands that, because medication can be pretty complex and convoluted. So I just try to have that conversation with them saying, well, this really isn't gonna help with that. I can't prescribe what they can take. Like I can't say, go take this, but I can say, well, this won't be better, and I know over the counter there are X, Y, and Z available, and kind of say it like that. And then when you give it, again, just make sure you document it, okay? Make sure it's stored out of their reach. It can't be stored with food. So like refrigerator antibiotics cannot be in the same fridge as our lunch.
We have our own medication fridge.
Perfect. Questions about meds at all? No? Okay. Okay, food allergies are next. It can be known or unknown. If I have a kiddo in the center, can I request that y'all don't give them bread? It's not a food allergy, but I just don't want them to have bread.
Yes.
How do I do that? Can I just tell you?
Fill out a
Declination form.
Yeah.
I need it.
Yeah. So again, I can't remember maybe all of the forms that I have to fill out, but anytime there's a transition, if a parent tries to tell me something, like, hey, can you give Susie Tylenol today at 4 o'clock? Or, hey, green beans, we're wondering if there's allergic to them, can you not give them green beans? Chances are we need to have them write it down. Because I might not remember it. 2 hours later, was it peas or was it green beans that he can't have? I don't remember, right? Just have him write it down. And not only, does that help me remember, that keeps everybody on the same page, because I might get a tummy bug and have to go home sick, and now you're covering my class and you have no idea because it's not written down, and I was in so much pain I didn't tell you. So again, transitions are a good idea to have things written down. People can be allergic to food that they've eaten their whole life. So kind of transitioning to food allergies. The most common things people are allergic to are things like nuts, dairy, eggs, and then they kind of fall off from there. There's a top 9 now. It used to be a top 8. But some people can be allergic just by eating it. Some people can be allergic by touching it. And some people can be allergic by being around it. But that's very rare. Very rare. Like in my 15 years here, I think I've had 2 kiddos out of all the kiddos here that kind of had like they could have had a reaction just by being in the same room as, and it was either latex or peanuts. Okay. So just know that that's not common. So just because someone has a peanut allergy doesn't necessarily mean that you can't have peanut butter. Not that we feed everybody peanut butter, but just as an example, doesn't mean you can't have peanut butter in the room or they might have a reaction. Obviously, we don't want them to touch it or eat it, but typically it's not an airborne thing. That's pretty rare. And there can be a known allergy or unknown. And most reactions that happen at school, honestly, are because of an unknown allergy. For example, the only time I've ever personally given an EpiPen was to a kiddo. He was in middle school. He had eaten pistachios his whole life. He probably had them every day at lunch, forever. And then one day just came in my office. He said his throat felt funny. He kind of started clearing his throat. Like, something doesn't feel right. Swallowing a little more. What's going on? What happened? What did you eat? Did you get hit in the face? Like, just kind of asking questions, trying to figure out. And then his stomach started hurting. And then he started having a little trouble breathing. So when you have like multiple body systems involved, my first thought is always allergies, right? Because now I have like tummy, like GI, I have swelling, and now he's saying it's a little trouble breathing. So breathing, like those are different systems. Where like skin is another system. Multiple systems, think allergy. Like, how can I kind of figure out whether this is an allergy or not? For him, it ended up being, gave him Benadryl, he threw it up, ended up calling 911, calling the parents, and at that time, I had standing orders for epinephrine, where I could give epinephrine to anyone on campus who was having a reaction, thankfully. That pediatrician has now since retired, so I don't have that on campus right now, but gave him epinephrine. Like I said, he was wheezing, he had thrown up, his stomach hurt, he was clearing his throat, he felt swelling, and we'll talk about the how of the epinephrine in a minute, but it's amazing how epinephrine works. It's super fast, but it's also kind of scary how fast it wears off. And the reason I say this is because by the time he had it, by the time EMS got there and his parents got there, he was perfect. His lungs were clear. He no longer had any swelling, no breathing issues. His tummy felt better. Like, he was good. He looked perfect. We're cured, right? No. So when you ingest something, even if you throw up, there still could be some in your belly, and it could be 48, 72 hours before your body processes all of it. So that reaction can still, like, he's not out of the woods yet. He's still danger. So I highly encouraged the family to have the ambulance take him to the hospital, even though he looked perfect, just because that secondary reaction can be just as life-threatening as the first one. And even though he looks perfect. Now, parents can decline an ambulance, they can sign off on it. If it's an adult, they can sign themselves off and say, no, I don't want to be transported by an ambulance. I get it. Ambulances are super expensive, right? Super expensive. So in my brain, I'm like, I don't want to spend $2,500 for an ambulance to drive 5 minutes down the road to Stone Oak. Well, have you ever been stuck in Stone Oak traffic at 2 o'clock on a Wednesday because of no reason at all, right? Like, that's reality. Now, what happens if you're there and you can't, and you start having a reaction again, or they start having a reaction again? You can't get another EpiPen, and you don't have another EpiPen. You can call 911 again, but you're stuck in traffic. How are they going to get to you? They can't, like, Baja up and over the buildings to kind of get to you. They can't. You're stuck. And then it starts spinning out of control again, which is very dangerous. So it's not worth that ever not worth that. I always highly recommend go in the ambulance. You can pay that ambulance company $20 a month for the rest of your life to pay off that ambulance ride. It's okay. Medical debt is different than regular debt. So take the ambulance. Highly encourage them to take the ambulance. Anytime I have a reaction here to here, I always think epinephrine. When I say EpiPen, just know that that encompasses any kind of epinephrine injector, and I'm going to show you 4 different kinds. But it's like saying I need a Kleenex. Now, does that mean I can use a Puffs? Of course, it's the same thing. Or I need a Band-Aid. Can I use a NextCare bandage? Of course. Or Jello, right? Can I use gelatin? Yes. So EpiPen, because EpiPen was the first brand on the market, and they had a phenomenal marketing strategy. Everybody associates EpiPen with any of these officially epinephrine auto-injectors. Okay, so they're all, when people say EpiPen, it doesn't matter which one. They all have the identical medication. It's just the delivery system, the little fancy little pen-looking thing is different. That's the only part that's different, okay? So you always want to give epinephrine, I would say Epi First and Epi Fast. These are trainers, they do not have needles in them. So we can play with these. When in doubt, if you're not sure, give it. You're not going to hurt them. The risk of waiting too long to give epinephrine far outweighs, like big caps, bold letters, huge font, all the things, far outweighs waiting an extra 30 seconds or a minute before you give this. A really sad story I know of is a teenager who was in California at a camp. Parents were both physicians, and it was a known allergy. He went to the camp kitchen, and they had little snacks there, and they had Rice Krispie treats, so he took a bite. Didn't even swallow it, didn't even chew it up. Spit it out, tasted the peanut butter in the Rice Krispie treat. Rinsed his mouth out immediately and went straight to his parents. They had EpiPens. He got 4 EpiPens 5 minutes apart and still died. Okay? If you think you need an EpiPen, use it. Do not wait. Okay? This works really fast, but your body can also work really fast against yourself. If it's reacting super fast and it gets past a point of swelling where you can't breathe anymore, it might be too late. Okay? So if you give someone epinephrine and they don't need it, they're going to feel like they had a bunch of coffee. Like if you've ever been surprised or like someone scared you around the corner, you know how you get like that little boost of adrenaline? That's what this is. It's adrenaline. Your body makes epinephrine naturally. This is just a bigger dose. So the onset, it starts working fast, but it also wears off fast. So don't worry about, oh, I don't want to hurt them. Because remember, when our brains are under stress, we start losing detail, and our brain starts looking for risk and threat. So our brain will look for, oh, I don't want to hurt them. I don't want to hurt them with this needle. I'm not sure if I should give it. And our brain will kind of stay stuck there. It's how we're designed. So just know that that can happen, which is why we do this every year too. So we can just be reminded every single year, this is not going to hurt them. It's not going to hurt them. It's not going to hurt them. It's not going to hurt them. Logically, in our logical brain, we know that. But as soon as that stress is involved, the logic kind of starts to fade. The details in our brain start to fade, and our brain starts to look for risk. And a needle is a risk. Just like an AED is a risk. People don't want to use an AED because they're worried about electrocuting somebody. They're afraid of hurting them. An AED is not going to hurt them. It is not going to hurt them. It's not going to hurt them. It's not going to hurt them. But your brain will start looking for risk because it's kind of panicking because it's a survival skill, right? If I'm in survival mode and I'm looking for risk, I'm more likely to survive. So an AED is not going to hurt them. This is not going to hurt them. Use it if you think you need it. Epi first, Epi fast. Do you give the epinephrine first and then call 911, or do you call 911 first and then give the epinephrine?
First.
Epi first, Epi fast, and then call 911. It's an automatic 911 call, and an automatic, highly encouraging them to go to the hospital in the ambulance, even if they look and feel fine by the time they get there. Okay. Questions about when and why to use these. Okay. Now the how. So again, when your brain gets super nervous or stressed out, the details start to fade and you start honing in on the risk. So we can have done this 15 years in a row and your brain will forget and you'll be trying to give the epinephrine just like this. I forget that there's a blue safety cap on there. So just remember, look at the side. Every single brand, it doesn't matter what kind it is, has directions on the side of how to give it. All of them do. So this isn't working. What's going on? Oh yeah, look at this. Oh yeah, there's a blue safety cap on there that I have to take off, right? And we can laugh about it here because it's like we're in our logical brain and our brain is calm. But as soon as your brain starts to like get that adrenaline rush and starts to worry or get nervous or panic, those details like just fade away, okay? Especially if it's someone you know, if it's a kiddo in your classroom, right? There's even more connection there. So we have to take the blue safety cap off for this to work. If I'm going to give it to myself, can I give it in the top of my leg? No. Can I give it in my arm? Can I give it in my butt? No. The ideal location to give it is if I was going to stand up and give it to myself, is if I had it in my hand and I would go straight down on the side of my leg. So I would try to avoid the seam of my pants, but I don't have to take off my pants. I can give it through my pants, just try to avoid the seam. And if it's an adult, check for a phone or keys, right? Because it won't go through a phone or metal. But look for that. To reset it. And then when you give it, I have to take the cap off. Push, and actually push it in the side of your leg. You have to push harder than you think you do, and hold. It's not push and release because it's like a spring mechanism that'll squirt the medicine out. If I push and release, now psh, there goes all the epinephrine. And we laugh because, right? But when you're nervous, it's super easy to forget that part. So it's push and hold, count to 5. Every brand will tell you something different, but I always teach 5 because even if I'm super nervous, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, this has time to inject in my leg. When I take it off, I want to massage because that'll help the medication absorb faster, which is what I want. And then if you think of it, look at the time. Okay, but chances are, if you don't remember what time you gave it, it's not a huge deal because chances are someone's calling 911 for you at the same time, so we kind of have an idea, like, of what time it was given. Okay. So that's this brand. This is kind of like the Cadillac of auto injectors. First one that came out, they're about $675, I think, a pair. And they're super expensive. And I like having 2 at school because it might be 5 minutes and I have to give another dose. Average response time here, station 43, if they're there on bidders right there, is about 4 to 6 minutes. So, I mean, from the time I call, in 5 minutes, I might need another one because if they're not getting better or if they're still feeling bad, I might have to give a second one. That's why I want 2. And then they'll have more. There's also, this one's called an AVIQ. So AU is audible, like you can hear it. VI is visual, so you can hear it and see what's going on with this one. So when you open it, there's directions on the inside, just like the EpiPen brand, but it also starts talking to you. And you can open it, that's fine. You can open it. You can open it and then look at the side, it's still there. So she'll talk to you. So I want you to give this one in the side of your leg too and feel it's a little bit different than the EpiPen. Perfect. Okay. So these are really nice. They talk to you. They tell you exactly what to do. So they make us feel more comfortable. But don't forget, if this is a real life situation, the chances of the room you're in being quiet are pretty low. The kiddo might be crying. Someone might be panicking. You might have someone next to you on the phone at 911, so they're talking loud because they're super nervous. Okay? So while that's nice, you know what to do. And that's why it's also visible on the side. And the other thing is I don't have to wait for her to talk to me. If I know what to do, I can just open it, give it, and I don't have to wait for her to tell me what's going on, okay? But these are fabulous. These are really, really nice. You will have different colors of these. All it is a different dose You don't have to worry about that, but just know, of course, the two brands or the multiple brands are made by different companies and they can't agree on a color scheme. So, you know, a red over here might be a yellow over here. It's all good. There's two other brands that we have. And I want you guys to kind of play with this one too. So it looks a lot like an EpiPen, but this one's called a Tiva. This is the newest one on the market. It just came out, I'm thinking 2, maybe 3 years ago. So it's nice. It looks a lot like an EpiPen, but honestly, when you play with it, it's not as nimble. Like, it's a little more awkward to use. The little blue cap is a little bit harder to get off. The bottom, you don't pull off the gray cap. You have to kind of twist it off. But again, just something, another brand out there. And it might depend on what brand the insurance company covers. And it also might matter what the pharmacy has in stock. Because just like everything else, you know, supply chain issues, right? It might depend. They might want Auvi-Qs, but they can't get Auvi-Qs. They might get Tivas. Or they might get a generic one. We have generics too. So these are the cheapest, where those are about $6 and some odd a pair. These are about $3 something a pair. But these don't have all the Cadillac bells and whistles that the rest of them do. But again, the medication is the same. So the medication is not different. It's just the delivery system is different. So the difference here is where the EpiPens will come in like a plastic tube with a little flip top, kind of protect it to take it out of. This has two ends, you know, that you kind of pull apart to take the pen out. But the risk is when I'm nervous, yeah, I have super strength and super speed, right? So if I open it and go, wow, it's gonna like go flying across the room and might hit the wall. So just be mindful of that when you pull this one apart. Just go a little slower than you think. The other thing this one has is it has two ends that you have to pull off. You have to pull off both to be able to use it. Now it's not orange, but it's red. You can tell which end goes against their body and not. This one also will not cover the needle when you give it, okay? So when you give it, you don't have to. But I'm a huge fan of covering the needle just because there's a big risk. If I just set it down, things are happening, lots of people are coming in, parents are coming in, EMS is coming in, I've got a guy with a computer, I've got a guy with a red bag, I've got two guys pushing a stretcher, they're pushing my stuff aside, right? It's super easy to get poked then by a dirty needle. But with that being said, never, ever, 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 never, ever, ever go hand to hand. Because I'm shaking, I have super strength and super speed right now, right? None of those things are in my favor when I'm trying to do this and cover a needle. So I always just put it on the table, scoop it up, and then push it off to the side. So that way if somebody does knock it, then it might roll the tip off, but nobody got poked with the end. Does that make sense? Okay. These are round. They will roll off the table. They don't have that super cool feature of being kind of flat. They won't roll off the table. But again, these are about half the price.
Is there still a shortage?
It kind of it ebbs and flows. And typically when parents fill these, they're only good from about 13 or 14 months from the day they pick them up. So if I need 2 at school, and you need 2 at home, and grandma's house needs 2, and the nanny needs 2 in her purse, every 14 months, that's a lot of money. They're super expensive. Now, with that being said, expired epinephrine is still functional, okay? So what I tell my parents is, I can't have expired meds at school, so bring me the new set, and you take the expired set. But as a parent, I would keep it. They actually did a study several years ago on 7-year-old epinephrine, and it was still 70% effective. So as a parent, keep them. Keep the old ones. Give grandma 2. You keep 2. Don't keep them in the car, but keep them in your purse. Keep them wherever you need it, because if that's what you have, use it. Okay? But at school, at daycare, we're supposed to have unexpired meds. Questions? Epinephrine, medication, when, why, how? Anything?
Why do you give it in the thigh specifically?
Great question. So on the side of the thigh specifically is because there's fewer blood vessels and fewer nerves here. So it's a safer spot to give it. On the top of your leg, there's a little bit more risk of hitting a blood vessel, and we don't want it to go directly into the bloodstream. Also, on thighs, when you're looking at a chunky little baby, you know, the top of their leg has a little more fat. These needles aren't that big. They really aren't. It's not, you know, the big scary risk that our brain will make it out to be. So chances of it getting in the right spot is just better on the side of the thigh, just because it's not like that big extra floof that could be on the top, or there's a big old nerve in your butt that's super easy to hit. Good question. What else? Anybody? All right. If you guys ever get a kiddo with an EpiPen or allergy or whatever, and you're like, oh, I know we talked about it, but I don't remember what she said about the Tiva or whatever, call me. I have trainers. I'm happy to bring it over. We can go over it again. The more we do this, the more you're used to it. When your brain stresses out and forgets the details, the more, not that it's not a stressful situation, but the more likely you are to remember like the few key things. That'll kind of help everybody involved, okay? I think I hit everything.
Now, with the washing hands,
Uh-huh.
you never said to or whatever, but is it best to shut the water off with the paper towel?
Okay, yes. So the steps to, good question. Washing your hands, you get your hands wet, put the soap on, we scrub for 20 seconds, right? Tops, bottoms, in between your fingers, under your nails, get your wrists, and don't forget your left thumbkin, or whatever it is that you might forget. You can turn your water off during that time, especially in South Texas. It comes up a lot. We're in like a drought or, you know, water wasters or whatever. So officially, that's not in the order of operations for washing your hands. But if you think about it, I turn on the water, so the handle's dirty. I get my hands wet, I get my soap. I'm scrubbing my hands. I turn it off with the back of my hand, okay? And I wash my hands. So now the handle's still dirty, and my hands are clean because I've scrubbed it, okay? Now I have to turn the water back on. I like to use the back of my hand just because it makes me feel better. And then rinse. So my hands are clean. They're still clean. The handle's still dirty. So then I can dry them and then turn it off with a paper towel. So yes, officially that's not in like the big, you know, procedure manual, but you know, then there's reality, and we don't necessarily need the water running for 20
So
seconds.
if we
every other
had Miss standing behind us,
I would do it the way textbook says if they're standing behind me, if I'm
Okay.
being honest, just because then they're not going to ask you for rationale and show me why that works and why do you think that's okay and all the things. But in reality, yeah.
Okay.
I mean, right, because if we think about where the germs are and what we're doing, just like people, it cracked me up. So it's good marketing, right? When the I don't remember what the brand, maybe Glade, where they had that automatic soap dispenser. Never touch a dirty soap pump again.
yeah.
Sounds like a great commercial. But if I'm touching a dirty soap pump, does it really matter? Because I'm putting soap on
my hands.
my hands. Okay. And I'm washing off the dirt from the dirty soap pump and I'm rinsing, right? But it's great marketing.
Yeah.
And it sells a lot of things. But good question. What else? Anything? Anybody? Okay. All right.
It's very thorough.
Well, if you guys think of anything, I'm always around. Let me know. Always happy to help. Okay.
Thank you, Amy.
Yeah, of course.
Thank you.
Yes, thank you.